Welcome to your video guide on travel healthcare. I'm Kay from TravelNursingNewbies.com, and in this video we're going to introduce you to travel healthcare. So come on and join us now. Travel healthcare just got easier. Hey, this is Kay from Highway Hypodermics, and today we are going to start our series on travel nursing newbies and how to get into travel nursing or travel healthcare. There are a lot of opportunities also for allied health therapies and even lab people. In this video, we're going to learn who are the players in the adventure, what exactly are you getting into, where do you want to go, when can you spread your wings and fly? Why do you want to be a healthcare professional? And how to get started. First of all, who are the players? There's 4 major players in the travel healthcare. The number 1 is the healthcare traveler, which is you. Number 2, we have a recruiter. A recruiter is the person who is going from the agency who will help you get your assignment and get to going. The hospital, of course, is another player. That is where you are most likely going to take an assignment, although there are some long-term assignments and even prison assignments. It's amazing where people are going now. Next, we have the patient. The patient is one of the most important people in this role because that's who we are traveling for ultimately, is to take care of patients all around the United States and around the world. Just what is travel healthcare? Travel healthcare is taking assignments around mostly the United States. They are usually 8 to 13 weeks and even 26 weeks. The most common is a 13-week contract. You will be working with an agency or a travel company. An agency is a company that procures your assignments. Through different means, they get the assignments from the hospitals and they connect you to the hospitals. Whenever they connect you to the hospitals, you will have what is called a contract. Now, the important thing to know about contracts is that there is a contract between you and the agency, and there's also a contract between the hospital and the agency. So that's something else we're going to get more into when we talk about contracts. And what is the pay? Of course, nobody wants to do this for free. So with your pay, it depends on different companies, but you should get a non-taxable wage, and then on top of that you're going to get stipends or reimbursements for your meals, incidentals, and lodging. Now, these numbers vary widely between the different parts of the United States and your specialty and how the travel companies are formulated. Some of them go on like even a 5% margin, and some of the publicly traded companies may even go up to a 15 to 20% margin. The next thing that you want to do is, whenever you're thinking about traveling, is know, where do I want to go? What is your ideal landscape? Oh, are you going to travel to go to the mountains? I live in the mountains, so when I travel, I want to go to the beach. Where can you travel to? You can travel all over the United States. I've been to South Carolina, I've been to California, Texas, Iowa. I've been to Iowa twice, so it's not too bad of a state. There's just you're not limited. You can go to Florida. You can be in a hurricane in Florida. Been there, done that. Life's an adventure whenever you're a traveler. What kind of hospitals do you want to work at? I came from a critical access hospital, 25 beds, and my first assignment was actually in a small level 1 trauma center. So you can go from critical access to level 1 trauma center. I've worked in a 650 bed, the largest rural hospital in Mississippi. And you can just stay in level 1 trauma centers. Duke hires all the time. MUSC in Charleston hires quite a few travelers. Banner in Arizona, you can be a snowbird. I learned how to be a snowbird at 35 instead of 65. So, you know, your locations are just, that you're not limited on location. Where there's a job, you can go. Another thing that you want, whenever we're talking about where do you want to go, is where do you want to be housed? There are several housing options that you can look at. A lot of travelers do Airbnb or a room share kind of thing. It's funny on housing. When I first got into travel nursing, the housing was, everything was a shared housing. So next, the travelers started not liking the shared housing. So then we went to, everybody advertised free private housing. So now that the economy has kind of changed, well, now we're back to shared rooms. A lot of people we're buddying up again. So now we're buddying up, but we're picking who we're buddying up with. And there's a lot of shared housing. And of course, the most sensible way, I think, because this is how I travel, and I pull my house behind my pickup. So I travel in an RV. You can travel in a travel trailer, a fifth wheel, a motorhome. It's a great way to go because you always have your house and you always have your bed with you. When can I spread my wings and fly? This is kind of a trick question in the fact that you really need 2 years of experience is what we really would like to see. I have known LPNs that when they get their RN, they will have a years of experience, and because they have several years as an LPN with 1 year of RN, they're doing okay. The thing is that you need to figure out if you are ready. We have several ways of doing that. Number one, I like to get a skills checklist for your department, your field, your ICU, OB, whatever. And whenever you can do 80% of those things by yourself, then I believe that you're ready to go. You do not want to get into travel healthcare and lose your license. That is a very distinct possibility if you are not ready, okay? It's very important that you must have confidence in your skills and that you realize that you're not going to get very much orientation. I've had up to 4 hours of orientation, okay? That's a possibility. A lot of hospitals do give you the 1 week, the 3 days, 3 12-hour shifts of orientation, but you aren't always going to get that. You have got to be prepared to hit that floor on both feet and run. Okay, it's your license. Be very careful that you know your skills. When can you leave for your first assignment? From the time that you apply to a company until the time that you actually leave usually is a couple of weeks. This depends on your credentialing status. We have to get drug tests and we have to get titers, and there's just an amazing amount of credentialing that has to go on. You have to have physical, you have a fit test. So usually that takes about 2 weeks to get all of that done. And when do you get your housing? If you're in company housing, which is still around, although we don't use it very much, if you have company housing, usually you can move in 2 days before your assignment starts. I know that seems like a very short time, but remember, we're travelers, we're mobile, we're supposed to be running on our feet. And if you're doing your own housing, then you can get in whenever you want to, the week before. I try to get there a little bit early so that I can go around town and see, kind of get the lay of the land. And then I also make a trip from my house to the hospital, try about the same time of day, so that I know exactly how long it's going to take me to get there. Because you don't want to find out how long that there's rush hour traffic in there whenever, when you're at 7 o'clock in the morning and be late for your first day. Remember, you only have one opportunity to make a great impression, first impression. Okay, so housing is usually, and if you're in an RV, then we usually end up there sometime the week before. We leave the Monday before I start on the next Monday. When do you get paid? Okay, it's another big question. When people first start going into traveling, when do I get paid? You're going to work the first week, then you'll turn in your time card. Usually your time card needs to be turned in Monday morning before 10 p.m., at least by noon. They want you to have your time card in. So then you'll get that paid that next Friday. On that first paycheck, with most companies, you will receive a week's pay, both your wage and your housing stipend, and usually you will be paid a traveling stipend. Okay, your traveling stipend, the most of them are like $250 to $300. I can't even get my RV out of Idaho for $250. So realize when you're getting into this that you need a little bit of money saved up to get you to your assignment and get you through that first week. Why do you want to do this? It's an adventure. The most important aspect of travel healthcare that I have noticed between everybody who does it, whether you're happy or not, you must thrive on change. I change units every year to 2 years. I find that if I get on the same floor and do the same thing over and over again, I get bored and lazy, and I don't want that for me, but that's what happens. So you need to thrive on change. I thrive on change. I like some stability, and I take a lot of 6-month contracts, but still I'm changing every 13 weeks to 26 weeks. Why do you want to be a traveler? Why are they used? I want to be a traveler because I want to help out where there's maybe a shortage. People may go on vacation. There for a while, there was like 2 years to where all I did was maternity leaves. They would take off to have their babies, and I'd come in and work for 13 to 26 weeks, however long they had for vacation and FMLA. A lot of times they will use them if they have a hard time getting staff in that area. There's some areas of the United States, South Dakota, North Dakota, in the winter are not the most exciting places to be. They do have a problem with keeping nurses there. But let me tell you, one of my best times that I ever had was in North Dakota. We had a really good time. We went ice fishing. I drove my car out on the lake. Okay, you don't get to do that in where I'm originally from, in Oklahoma. You don't get to drive your car out on the lake. That was kind of different. But there's, wherever you go, you're going into places that the conditions sometimes they aren't going to be really good. That's why you need to have a strong personality. If you're going to go into this, you got to have a backbone. You got to be able to stand up by yourself. Why would you want to do all this? Well, it's not so much those 3 days in the hospital, but it's your 4 days off that is going to be, a big draw. Get to see all kinds of places. Get to be in all kinds of weather. We've been through hurricanes. We've been through snowstorms. We've been through several earthquakes in California. It's all an adventure. We took off when my son was 13, and we did homeschool, and he learned all about, we stayed in Mississippi and around and went and visited in Alabama and Georgia, and he learned history. He learned Civil War history from going and visiting battlefields and going to see all these other historical places. It's kind of funny now that my husband and I were talking on our last assignment, we passed by a historical site, and it's like, whoo, we didn't have to stop there now because we stopped at all the historical sites. That's another thing. You know what? Just because you have kids doesn't necessarily mean that you can't be a healthcare traveler. Why did I get into this? You might ask yourself that several times. There's been several situations to where I've had to stand up for myself. I've had to stand up for my patients. Gone heads to heads with physicians to get my patients what they needed. But you know what? I wouldn't change my path of where I've been. But you got to know what you're getting into if you're going to go into this profession. And it's not all roses. There are some thorns. The biggest question that travel healthcare professionals, I find, ask themselves once they get into it is, why didn't I do this sooner? I thought that I had to provide a stable environment for my child, so that's why I didn't do it for quite a while. I got 5 years of experience, so that was good. But the biggest question you're going to ask yourself is, why didn't I do this sooner? I know it's scary, but you really need to do it scared. Okay? It's fun, it's hard, but travel healthcare is a very rewarding career path. Okay? So our next video, we're going to start on getting your credentials done, and we're going to plan on how you get there, and we're going to do a lot more stuff to get you ready to go. We have 9 videos. This is the first one. We have 9 videos in all, so come on back, y'all, and we're going to learn some more.